Fever, also referred to as pyrexia, is defined as having a temperature above the normal range due to an increase in the body's temperature set point. Normal body temperature minus 98.7. The increase in set point triggers increased muscle contractions and causes a feeling of cold or chills. This results in greater heat production and efforts to conserve heat. When the set point temperature returns to normal, a person feels hot, becomes flushed, and may begin to sweat. Rarely a fever may trigger a febrile seizure, with this being more common in young children. Note: fevers do not typically go higher than 41 to 42 degrees centigrade, 105.8 to 107.6 degrees Fahrenheit. Causes: a fever can be caused by many medical conditions ranging from non-serious to life-threatening. This includes viral, bacterial, parasitic infections, such as influenza, the common cold, meningitis, urinary tract infections, appendicitis, Lassa, COVID-19, and malaria. Non-infectious causes include vasculitis, deep vein thrombosis, connective tissue disease, side effects of medication or vaccination, and cancer. It differs from hyperthermia in that hyperthermia is an increase in body temperature over the temperature set point due to either too much heat production or not enough heat loss. Types: continuous fever, where temperature remains above normal throughout the day and does not fluctuate more than 1 degrees centigrade in 24 hours, e.g. in bacterial pneumonia, typhoid, infective endocarditis, tuberculosis, or typhus. Intermittent fever, where the temperature elevation is present only for a certain period, later cycling back to normal, e.g. in malaria, leishmaniasis, pymia, sepsis, or African trypanosomiasis. Remittent fever, where the temperature remains above normal throughout the day and fluctuates more than 1 degrees centigrade in 24 hours, e.g. in infective endocarditis. Or brucellosis. Epstein fever is a cyclic fever that is rarely seen in patients with Hodgkin's lymphoma. Undulant fever, seen in brucellosis. Typhoid fever is an example of continuous fever, and it shows a characteristic stepladder pattern, a stepwise increase in temperature with a high plateau. Symptoms of fever is usually accompanied by sickness behavior, which consists of lethargy, depression, loss of appetite, sleepiness, hyperalgesia, dehydration, and the inability to concentrate. Sleeping with a fever can often cause intense or confusing nightmares, commonly called fever dreams. Mild to severe delirium, which can also cause hallucinations, may also present itself during high fevers. Diagnostic method. There are various modes to diagnose fever by placing the hand on the forehead. Most acceptable is through thermometer. It is placed under the tongue for 5 minutes in adults and under the armpit of children for same duration of time. Treatment to reduce fever is generally not required. Treatment of associated pain and inflammation, however, may be useful and help a person rest. Medications such as ibuprofen or paracetamol, acetaminophen, may help with this as well as lower temperature. Children younger than 3 months require medical attention, as might people with serious medical problems such as a compromised immune system or people with other symptoms.